Bipolar disorder is a condition in which people experience abnormally elevated and abnormally depressed states for significant periods of time, which interferes with their functioning. Dr. Himasiri-de-Silva of St. Joseph Hospital in Orange explains bipolar disorder and the treatments for the condition.
The theory is that you are born with a genetic predisposition, and the first episode there is a trigger, something happens, either loss, move, some trauma, car accidents, whatever it is, there is a trigger. Once it is triggered, usually it does not need to have any other triggers for it to come back again. When you say bipolar, it can have different sets of symptoms. Mania, for one, where you can have accelerated activity in your brain and the body. It's very highly variable. The mania can last a long time unless treated, and but something happens to them. They can be very disruptive. There's a part of mania where you can get extremely angry and impulsive, and you may end up in jail for your actions. There's about 50% of the patients with bipolar illness who have something other than bipolar illness. It may be a substance abuse, it may be anxiety disorder, it may be panic disorder, and unless they are detected and treated, you won't get the patient completely rehabilitated. So in the manic side, where you can have more activity, more energy, less sleep, increased talkativeness, sometimes fantastic ideas in your head that you are capable of doing, what we call the grandiosity, purposeless activities, impulsivity, sexual indiscretions. And then you can have depressions where you are much slowed down, your walk is slower, your talk is slower, you don't get the same thoughts in your mind, they are all slowed down, you lose your appetite. Most of the time sleeps more in bipolar disorder, or you spend more time in bed. So everything is at a halt.
We asked Dr. De-Silva about what treatments are available and effective.
First, establish the diagnosis. Make sure that the patient has a bipolar disorder. That's one. Number two is try to focus on what the patient is presenting with. If it's a depression, you may have to take care of the depression. If it's a mania, you have to take care of the mania. So that treatment may be a little different from the third step, and third step is a long-term management of this patient. If we follow the guidelines that are set by the thought leaders in the country, people who are very interested in bipolar disorder, and like the American Psychiatric Association treatment guidelines, if we follow them, we have very good success. If we don't follow them, we have a lot of residual relapses in these patients.